Okay. Sounds good.
All right. Good afternoon. Good afternoon. Hopefully those that are out here listening online, we have this running streaming live for the people that want to see at their desk, and then we also are going to do it via video. So those of you in your departments that may not be here able to attend, they can look this up online, so we'll be able to answer a number of questions. It's an exciting day. We had some conversations this morning. We'll have some follow-up conversations this afternoon, really about something that the county is investing in for not only you as employees, but you and your dependents. And it's about our new employee fitness, our fitness center being one. Our employee health clinic, though, is also going to be rolled out. And the kickoff's going to be taking place on the 24th. And it's really a commitment by the Board of County Commissioners to really invest in your health and well-being as employees. And so today's opportunity for you is really to ask questions, get some clarity. So I encourage you to ask any questions you may have. There's going to be an opportunity afterwards. If you don't get your question answered, we'll be able to do that, and I know our HR staff will be doing that as we roll this out. So we're really excited by the opportunity to really have a clinic that ties into our overall health and wellness and into our current plans, our UHC plan. We have opportunities for not only our UHC members, but our Kaiser participants. And those that have opted maybe to be waived from employee eligibility for benefits, they can still use the plan in the employee health clinic in a little more limited capacity. So Christy's here, Jennifer's here, both from Care Here, our partner in this endeavor that we've engaged to do our employee health clinic. So I'm going to turn over to them, and they'll tell you a little bit more about what we're planning and what's going to be rolled out in the near term. So, Christy.
All right. Well, welcome everybody, and thank you for coming out. My name is Christy Fraley, and I'm the Director of Clinical Services for Care Here, and I'm also a nurse. And I have with me Jennifer Brown, who is Corporate Clinic Manager for Care Here. And we're really excited to be here. We're glad with this partnership that we have with Adams County. We're going to be rolling out a clinic on the 28th is our first day to start seeing people. So mark it on your calendars. I just wanted to give you a little bit of information about Care Here. We're a company that is a national company out of Nashville, Tennessee. We started in 2004, and our primary focus is on-site employee clinics. So that's really all we do. We're here to kind of build a relationship with you guys in that although we are a freestanding, independently functioning clinic, that's something we get asked a lot. You know, I'm sure this will cross your mind. A lot of people have said, are you going to share my medical information with my employer? And no, we are not, because we are independently functioning. So our overall objective is to save costs to you, to save costs to your employer, but more importantly, provide excellent medical care. In addition, we also really focus on the confidentiality of it all. So let me go ahead and get started here. So does this seem like it's a little bit too good to be true? You know, you come in, that it's no cost to you, everything is free. What's the catch? There's always a catch, right? There's not. There's really not. I'm going to go through in detail today about what exactly you will be responsible for, what our job is, and hopefully if you have any other questions at the end, save them and we can go over that. But first I'll kind of talk about the benefits of it. It's convenient. This is right on location here. It's a brand new clinic. We are in the process of getting it ready this week, and it's looking absolutely beautiful. In addition, we pride ourselves on less than a 2-minute wait time. So when you come in, we'll take you right back. That's a great asset and very different than what you're probably used to from your regular primary care physician. I know there can be some long wait times, long times getting in for an appointment, and we offer same-day appointments. So that should definitely speed things up for you and less time for you to have to take away from work. So we also have an on-site dispensary. We have over 160 meds on our formulary that you'll be able to actually access on the schedule and see what medications we have. That's kind of an ever-changing thing. We anticipate when we come out of the gate what we think you might want, but if there's additional meds that we know you might need, that can change as well. So yeah, that's a big asset to everything as far as, that formulary right there on site. You don't have to go to a pharmacy to pick those up. In addition, we also do labs right on site, so you don't have to go to LabCorp or wherever it is you might go. I don't know what your insurance provides, but we do it right here on site and can get results back within a couple days for you. And we're very easy to make an appointment. You'll be able to do it either online or you can call. You'll obviously need to pre-register before all of this, but I'll go into all that as well. So it's a very simple process. Another asset we have is 24 hours a day. We have a support center, so we can help you with getting registered, scheduling appointments, things like that. But in addition, we have a nurse that's on call 24/7 for any emergencies that may come up, and they can advise you on where to go. All right. The quality. I want to talk about quality because that's the most important thing. We want to talk about the quality of our providers. They are in kind of an old, it's kind of an old style interaction that you have. You'll schedule an appointment, you'll come in, and you'll have minimum 20 minutes with them. You can either schedule a 20-minute, a 40-minute, or even a 60-minute appointment, which I know is pretty much unheard of in this day and age. So that's why we say it's a little bit of an old style. You come in, you get to know your providers. More importantly, they get to know you. You know the nurse on staff. It's just a really nice relationship. So, and as well as your family too. So that's something that everybody seems to enjoy. And again, it's back to that brand new facility. That's beautiful. All right. Brass tacks. This is where I want to detail it out. This is where I've had a lot of questions. So just kind of hold yours if you don't mind until the end on that. There's 3 different categories that you'll fall in. You'll fall in one of them. Either the Kaiser insurance, the United Healthcare insurance, or you're an employee that is eligible for insurance, but you've actually chosen to waive the benefits. So for the United Healthcare and Kaiser, as you can see, everything is at no charge. The office visit, medication costs, lab costs, and any health coaching that we provide. So there's no bill back fees. We don't bill insurance on this, so you're not going to see any costs later in the mail, nothing like that. This is just absolutely straightforward. If you are a waived employee, and I'm sure you all know who you are out there, there will be a nominal office visit cost, and it will be a $7 charge per med if you want up to 60-day supply, and a $15 fee for a 90 days and above supply for any. That's probably more of the chronic maintenance meds that you might be on. This is for employees only, so no dependents, but only for the waived employees, so just the employee only. All right, and what kind of services do we provide? We are just like a primary care physician. We provide acute care, we provide chronic disease management, we also will do any type of preventative. In fact, we would love to have you in for preventative. We know you guys have your HRA and your blood draw and all that coming up, and we're going to be helping you with any of that. I know that you have the option to elect to do that, and we can definitely do that at the clinic. You will also be at the health fairs that are coming up to draw your blood and do your HRA evaluation. When you go to register, conveniently enough, it'll lead you straight to the next screen that'll ask you those little HRA questions. So it's a very simple process for that. We also do well exams, annuals, anything like that, sports physicals for kids. So again, just kind of to show you the crowded waiting rooms and a trip to the pharmacy, but with us, you've got neither. You're going to just come straight in, less than a 2-minute wait time, convenient scheduling, as long as it works for you and your schedule at work. And we also have those private exam rooms. It is set up like a true clinic, and an on-site dispensary. So how to get started? So we have 2 ways you can get started. You can register by either calling the online number. You will be receiving all this information in the mail, so don't worry. I know it's not right in front of you, but you will be getting this in a variety of forms. You'll have a brochure that's going to be hitting soon, probably next week, if not this weekend. And in addition, you'll be getting a kind of a welcome letter that gives you information. That kind of leads me to my next slide. You'll get a welcome letter for each. If you're Kaiser and United, you'll get a unique identifier for each family member. Everybody's unique identifier is different, and you'll receive a separate letter for each identifier. You absolutely have to have this to register. This is, if you take nothing away from this, take that you need to get those unique identifiers and this access code. So your access code is really that you're divided in one of 3 groups, as you can see, Kaiser, United, Healthcare, or the waived employees, plus your unique identifier. The reason we have a unique identifier is that way we don't have to use your Social Security number. So there have been several questions about that, and it's not the same thing. So you will then, in addition to those letters that you're going to get in the mail, you'll get directions, and you can kind of see them here. This will be the same thing that you get in the mail, but it's always good to have it. If you look at it, it'll tell you step-by-step instructions on how to get started on online registration. So you can kind of see, how do I register? It'll walk you through. It's a very simple process. You'll click online, and if you can see on the second screenshot down where it says My Health Guide, just to make you guys aware, there's very tiny writing right there that tells you if you've never been enrolled before, this is where you click. So kind of focus on that lower right-hand corner, and then the rest is self-explanatory. If you're not comfortable with going online to register, you just take that unique identifier and your access code, and you can call the 1-800 number that'll be written on probably everything you see, and call, and we can assist you that way. I also recommend scheduling a get-to-know-me appointment. So if you are new to the clinic, obviously you are, all are, you're going to want to go in and meet the providers. We have several different providers. We have 3 different providers, and this, you can kind of meet each one of them, see which one you feel like is a better fit for what your needs are. We kind of did that on purpose. We like to give people variety so they don't just have one choice. So I recommend scheduling that get-to-know-me appointment. It should be about a 40-minute appointment, and bring all your medications with you, so that way you don't have to remember. I tell people, put them in a bag and bring them with you, so that way you don't have to remember the dosages and things like that. And this is also something that it's not just for you, the employee, but all of your dependents. If you're Kaiser or United Healthcare, you can schedule them for a get-to-know-me appointment as well. So in addition, if you're a tech-savvy person and you have a smartphone, which most of us probably do nowadays, you can do all of this online. Once you get registered and you have your password, you can go right online and schedule yourself for an appointment really fast. You probably, it's sometimes you can get a quick appointment right then, sometimes, and that's of course based on the convenience of what your work schedule is right now, but it might be a little bit later on in the day, but it's a very convenient process, as well as cancellations. If you are wrapped up in a meeting and you can't get away, just go online and cancel and you're fine. It's that easy to do. But we ask that you do that so that it'll open up that appointment to somebody that may actually want to jump into. So. All right, and if you do choose to go with our support center, these are the things that they're going to be able to help you with. Registration, do you like the very subtle need the access codes up there? So be sure to have those unique identifiers and access codes. They can help you with appointment setting, with cancellation, any general information questions that you might need, rescheduling of an appointment. Also, if it's after hours and you have a med refill that you might need called into the pharmacy because you ran out and you didn't realize, they can help you with that kind of stuff too. All right. And a last option is we have a live chat. So if you have any questions, you can go on there if you'd rather it be just a little bit more anonymous. So let me talk a little bit about our wellness. We have a very comprehensive wellness program that we're gonna be using. It's a portal. Care Here Connect is what it's called, and you'll have a link on your website there for Adams County that you can click, and it'll log you right into it. And we have all sorts of different options. We have a dietitian, we have registered nurses, health coaching that's a very general health coach, behavioral health, tobacco cessation if you're interested in quitting smoking, and exercise physiologists. And this is what the portal will look like. You'll click into it. It has programs that you can actually go on and classes and recipes and suggestions for stress management. There's just a lot of information. So I welcome you to go on there once you get registered and just kind of explore. Our hours of operation, if you'll notice, on this piece of paper that you picked up out front, it is a Meet the Providers. These are all the different providers that we have. And you'll see the hours at the bottom and also who's working what hours. Because if you find one that you like, I'm sure you want to stick with those hours. All right, and then just to let you know, you will not be required to take your sick leave to go to an appointment. This is something that a lot of people have questions about. You just make the appointment, make sure it works with your schedule at work, and you can come down during work hours. Even off-site people are welcome to do that. However, if you do have a dependent that you need to bring, then you will have to use your sick leave for that. So, and again, scheduling an appointment either online or calling the support center. All right, so let me kind of go over a couple of questions before I get to that slide. I want to talk about a little bit more. I get a lot of questions at these that are kind of repeat questions. So I thought I'd bring them up before you guys ask them, but you can ask them again, that's fine too. Do we accept walk-ins? And the answer to that is actually no, and the reason being is that if we accepted walk-ins, it would actually cut into appointment time of people, and I know you wouldn't want that if you're there, so we ask you to kind of honor that as well. That's why we make our scheduling nice and easy with a lot of different ways you can do it. So, do I have to change my primary care physician? No, you do not. You are welcome to still keep your main primary care physician if you absolutely love that person. You know, I don't blame you. You like to stick with what you know, and we work in conjunction with them. So we can, with your permission and signing, confidentiality forms and all, we can share labs, we can share test results, we can talk with them on the phone about changing medication dosages if that's needed. So we're very used to working with primary care physicians. A lot of people do tend to flip over and choose us as their primary care provider, but that's completely up to you. We're open to either of those. Let's see. Do you have to have an appointment to get medication, since we have the dispensary on site? And you do. And the reason is that this is a safety issue. If you're, whatever your particular situation is, that you're getting the meds prescribed for, the providers and the nurse, they like to lay eyes on you and make sure you're doing okay. So this is not about increasing the number of visits, and that's the difference between, kind of us and a regular primary care model, that we don't get, we're not paid based on the number of visits we can get in during an hour per hour. So it's a very different way we run the business. So yes, we'd like to have you come in. It can be a 20-minute appointment. It doesn't even have to last that long, but we do need to see you. Cancellations, please do it anytime before an appointment, up to 5 minutes before, but not after, because then it's technically you're considered a no-show. So let's see, the length of the appointment. That's something that when you go online, you'll see. There's a kind of a guide on the top of the scheduling that tells you, oh, if you're going to be getting med refills for more than 3 medications, you're probably going to want to do 2 back-to-back appointments. If you've got a well exam, go ahead and book 3 back-to-back. If it's just something for an acute need, it'll probably just be for 20 minutes. So there'll be a little bit of a guide there, but if you ever don't know, you can always kind of, call the support number and they can give you some guidance on that. And our formulary, I believe I addressed that in the beginning. We do have a formulary that's based on kind of what we're guesstimating you might need, but it is a very fluid item. We're going to be shifting it based on what everybody is going to want and need prescribed throughout the year. We anticipate that change. We always do with everything. So let's see if there's anything else. I think that's all I have for the known questions. So I'm going to just reiterate really quickly my highlights, and then I'll be ready to take questions. So first and foremost, go ahead and get registered online and schedule that Get to Know Me appointment with your unique identifier and access code online or on the call center. The appointment guidelines will be telling you how long appointment you'll need. And at that time, you can complete that HRA assessment, and it'll automatically populate to your chart, so I'll have that on record. Check out Care Here Connect, see if there's anything on there that you can use. I know there will be. We can all, find stuff on there. And then if you do decide you want to work with a health coach, when you come in to see your provider for that Get to Know Me appointment, ask them. They'd be happy to refer you to a health coach if you'd like. And then don't forget to take a copy of either your prescriptions or take that bag of medications, and that makes your life so much easier. So, all right. And I believe that's everything I have, so I'll open the floor up. Any questions that you might have? And Jen, I'll have you walk around if you don't mind. Anybody? Sure. We'll let Jen get to you first. Jen's going to get her exercise.
It's interesting to see how your services relate to people like United Healthcare and Kaiser, but I'm very curious to see how this interaction works. As a Kaiser member, my family and I, for more than 20 years, are your doctors allowed to talk to them, or how does this interaction work? It almost appears as though you're set up to maybe take some pressure off of them, but I don't know. I'm a little leery because I'm a guy who I need some specialized services.
Sure.
Cardiac, for instance.
Yeah. That's a great question.
So I just don't know that interaction.
Yeah.
And you mentioned earlier in your presentation that you are on site in other places. What are those other places?
We do have other clinics in other municipalities similar to Adams County. There's private employers that have contracted with us to come on site there. To address the first part of your question, as far as with Kaiser, you're not the first, so don't worry. You're not the only person. We deal separately in that we're not crossing insurance, nothing like that. We don't bill insurance. They are their separate entity. With your permission, we would just get a release of information form. So we would have your records if you would like for us to have them, and they can work in conjunction with your primary care doc there. If you have a specialty like cardiology, endocrine, anything like that, we would work within your referral system of providers that they have. So, and whatever doctors Kaiser recommends.
One last question is, Kaiser does a very good job of keeping prescriptions on file, meaning you get onto the Kaiser website, I need to renew something, you just get on there and renew it. However, they charge you a deductible.
Sure.
I see that you charge $0.
Right.
Do you share that prescription information? Do you say that if I were to say, golly, you charge $0, I'm going to go fill it with you guys.
Right.
Do they know that I filled a prescription with you guys?
The way that would work is if you would like for us to share that information and work, say, and I'm just going to use an example, say you wanted us to do diabetic management, but your primary care physician, you still want to keep your PCP. So we would talk with them and be in conjunction, and they would know if there was a medication change, we would let them know, or they would let us know. So we would speak to each other in that way. But it's your preference. If you would prefer us not do that, that's fine too. For refills here, we don't share that. They don't know because it's not billed through insurance and it shouldn't affect them in any way, how we have our formulary here. So it's kind of a little different that way. Does that answer your question?
Sort of, that's okay.
And you're welcome to expand, or you can even come up afterwards and I can give you more details if you'd like. I'm happy to do that. And who was next, I believe? Yes.
Hi, I'm Brian.
Hi.
So I'm about like 3 weeks away from running out of a maintenance medication that I use. I'd be more than happy to come to your clinic, but I don't want to come there and find out that it's not part of your formulary. Should I go ahead and just order it now? Would I be safer to do that, or how can I find out what is part of your formulary?
That's a great question. For meds like that, for that example, when you go online to register and once you're going into the schedule, you actually can click on a link that will give you all the available meds that we have at the clinic. If it's not something that we have, a provider can write you a script to do and take off-site. So that's things like narcotics. I will just let you know we don't keep narcotics or anything like that, controlled substances on site, but you can get a prescription for that.
So if I became a regular member, would you guys, and it wasn't part of your formulary, would that be part of that fluid part where, because I'm taking that medication, you guys would start to stock it just for me?
If we were able to get it, we would love to do that. There are, I'll let you know, there are some medications that it's actually not very cost effective in that sense because brands, very specific brand medications are not, it almost would cost more for us to keep it. So we would evaluate each medication depending on what it is. That's a great question. Anybody else?
Hi.
Hi.
In regards to the lab work that you perform here, do you keep a record of that online that I can access to track a history of my numbers?
Absolutely. You'll be able to look at your own labs and everything from when you log in and, you keep your password and all that. There's kind of a bar down the side that gives you different options of things. You can change your demographic information, anything like that, and your labs are accessible there too.
All right, thank you.
Yeah? Anybody? Oh.
Hi, my name is Judy.
Hi.
I'm part of the waived group. I get my insurance through my husband and his employer. As a result of that, if I were to use this clinic, would there be a copay?
There would. You would fall into the group where, I'm not sure if you remember, I had the slide with the grid. It was the $35 for an office visit and then a per medication fee. So it would be $7 per medication if it's less than 60 days supply. But if it's greater than that, it's 90 days and greater, you would have a $15.
Okay. And would the spouse be able to use this clinic, or is it just employees?
Just employees. That's part of the perk.
Okay.
Yes.
Forgive me if I missed this part, but I'm not sure I fully understand the prescription aspect. What if I normally get prescriptions by mail, and when that happens, I get a 90-day supply, and I'm wondering about the 3 tiers and how that cost is handled?
Right. We don't do tiers. It's either we have the medication on our formulary or we don't. We're not currently set up to do mail order through this clinic. However, that is something, if enough people are interested, we always are willing to look at that. And that's, of course, Adams County's decision. For that, it would probably be a little bit more cost-effective if you did use the formulary, if there were medications that were on that, because if it's no cost or a nominal cost, and you would just have to do a price comparison for yourself, I would, obviously advise to do what's best within your budget, but no tears.
Hi.
Hi.
My question is, in case I take a lab test and my A1C numbers are, let's say, sky high, will someone from your clinic or a doctor call me and say, Dora, you need to look? 'Cause, even though they're online and I can access them, sometimes, I'm not saying I'm too busy, but
Sure.
someone would call me to say, okay, they're good, they're bad, they're ugly,
We would probably suggest that you do a follow-up visit to go over them. That's kind of the nature of the way we do things. We like to have people come back in because it is your health, and it is so convenient that to just stop by for a quick, going over the results, we would really recommend that. So it wouldn't ever be a case where you just would have high labs. Our doctors and mid-level providers review all the labs when they come in. And yes, we would definitely, and if it was an urgent, hopefully it wouldn't be like a critical lab, we would notify you immediately. We wouldn't let that go.
Okay, thank you.
Thank you. You mentioned that most of your labs take 2 days, but do you have some of them, like, the 5-minute, 10-minute strips that you have there?
The
or-
immediate tests, like as far as like a strep test right on site, we do. I'm thinking specifically blood tests will take probably 2 or 3 days to be on the safe side. A lot of times we'll get it back sooner.
All right, thank you.
Sure.
I didn't see if you covered X-rays here. Do you have X-ray services at this building?
That's a great question. We actually don't. If you were to need an X-ray, then we would refer you to somebody that was within your network, and you would go and receive it elsewhere. But we would also get the results, and we would be the ones to go over it with you. Yes, that's a good point. If you did anything that would be off-site, it would default back to the regular way your insurance bills you. So if you had a copay, yes, you would do a copay. So, thank you.
If one of our covered dependents, let's say my wife is diagnosed here with high blood pressure and she gets on a revolving medication, does she have to come here to pick up that medication prescription every 30 days, or can I just pick it up on the way out?
That's a great question. No, it does have to be the person that is receiving the medications. And again, that's back to a safety issue. Like I said, it could be just a quick appointment. We also will give, if it's something that's a maintenance medication, we can give quite a few days out, 90, even up to 6 months if they're very well maintained on that. So we wouldn't require you to come in every 30 days if you were stable. Yeah. Any other questions? Now, one of you over here has to think of one, so Jen runs.
I'm confused, just about the medicine stuff.
Okay.
Because some things you can get a prescription and they're not refillable. And if a person doesn't choose to share information for you to contact their primary doctor, and they come in for something that they just recently received that medicine for, but really shouldn't get a refill on it, how are you going to know if they've been on it and really shouldn't have it again? Or, do you understand what I'm trying to say here?
Actually,
Rather
yeah.
than, like double medicating, that kind of thing, or
Sure.
if it's, if they choose not to share the information, you wouldn't know if they had it or they didn't have it.
That is true. It is up to the patient or a dependent's parent or whoever. It is. That's the responsibility of the patient, that they would need to say, hey, I've just been put on this medication. I happened to be in the emergency room this weekend and I got put on an antibiotic. This is what I'm, this is what I'm on now, and it's only for X amount of time.
What happens if something happens to them because they're not honest and they get put on it anyway and then something happens to them?
I
How does
hope
the-
that's not the case, and
Oh,
I
honey,
think
then
most
you know how
people.
it goes.
Yeah, but
I mean, I'm
that's.
just wondering.
You're right, and that is unfortunate. That is something that does happen. I mean, it happens in the whole medical realm. That's, I wish it didn't, and I wish that, there was a huge, database where we could all share one prescription. This is your medication list. But unfortunately, it's not that simple. And even at your primary care physician, that you wouldn't have that, you could have that same issue. So please be honest. Right, fingers crossed. Yes.
I'm sorry, I get a little dense sometimes.
No.
I guess I'm still just a little confused about your relationship with Kaiser and these other programs.
Okay.
You walk into a Kaiser clinic and you see your primary care physician and you need an x-ray or you need your medications or whatever the doctor says, do this, and you simply walk down the stairs into the lab and you get an x-ray, then you walk down the other hallway and you get your prescriptions.
Right.
And then your annual checkup with your specialist is in 2 months, and you go to the same building and you go see that specialist. I guess and I'm not trying to be disrespectful, but I'm trying to figure out what the purpose of care here is versus my group of doctors that I've already established. And I mean, quite frankly, I'm intrigued by the $0 prescription thing. I mean, don't get me wrong, but I'm still just confused about this relationship. I don't know if I were to go see you to have, because I got an earache. I mean, it seems to me like Kaiser should know that. I don't know, or vice versa. Maybe if there's some way you could enhance that relationship if you have enough time, I don't know.
Yeah, sure, absolutely. Well, and again, I kind of like what I was saying to your question. Since it's your medical information, there is a little bit of responsibility on you as the patient. So you would say, would you mind sending this to my primary care physician? And we will. And you'll sign, I mean, of course, you'll sign confidentiality and all that, but we would do that. Is the question, why would you come to the clinic here versus go to Kaiser when kind of everything right in one place?
I guess that's my ultimate question, yes.
Sure.
What's other than I don't have to take sick leave,
Right?
it's right here.
Mm-hmm.
I guess I'm still not seeing. I guess I'm still not seeing the tangible benefit, and maybe Todd needs to take me aside and school me or something. I don't know, but I guess I'm not seeing that tangible benefit other than going to a clinic that's right here in this building.
Right. So you actually did say the benefits that I would answer. So thank you. That was right. There's no copay for your medications. I mean, you can actually kind of crunch the numbers on your own. See what go home and in a 6-month time frame, look at what your amount would be for you and any dependents you may have. For office visit copay, for medication copay, or anything like that, and then you can kind of compare it and see that it's zero here versus even if it's a $35 or $50 amount, there's still that financial savings. So that's one major benefit and asset to you, as well as the convenience. Yeah, that's what I would say. If there's, like I said, we will share your information if you want us to, so that everything is consistent across the board. But you know what? It's completely an option. If this is something that you're doubtful about, That's okay. You can just come in for an acute care need. Say you're upstairs and you have a runny nose and you're like, gosh, you know what, I don't have the time to go and make the appointment and drive that way to, all the way to Kaiser. Just come down and use us for acute care. It's just that simple. Or at bare minimum, you can use us for your HRAs annually. And people do that too. So it's a complete choice for you. There's nothing mandatory at all. It's all dependent on your comfort level. Did that answer that? Somewhat, yes. And you're welcome to come talk to me after. I'm happy to talk to you about it.
Maybe I can answer a little bit of that for you, too. I'm a Kaiser member as well. And I see this as an option for me because, first of all, it's going to be a cost savings. I love Kaiser. I love my doc. My wife, never mind, that's another story. But anyway, I really am very pleased with the care I get at Kaiser. But by the same token, this gives me an option to obtain quality care at no cost, which ultimately I believe will drive down the costs that are incurred by Kaiser, which will keep my premiums down. And ultimately, every month, I have to pay that premium just like you do. So I see this as an option to keep my costs down, keep my premiums down, engage in a lot of the wellness activities. Kaiser has that. Care Here has even more. And I also see that there is, and I have to orchestrate that too. Like Christy said, I have to organize my interaction between my care provider at Kaiser and my care provider here. But I can do that. Because I can ensure that that information is transmitted back and forth, but it also gives me that option to, if nothing else, there may be some things that are bothering me health-wise that I don't, that I can set an appointment and engage with the health provider here that I'm going to have to spend, quite a bit of drive time and everything else to engage with my Kaiser provider. So it gives me, to me, I like it because it gives me a lot of options, but it doesn't negate Kaiser, it enhances it. It's an addition to the benefits that I already have, and that makes it just that much better for me.
Yes.
Thank you. Getting a second opinion from the primary care physician here, if you're believing you're needing like a CAT scan or an MRI, is that something that you can request at a Kaiser facility?
Yes.
If our other primary care physicians are reluctant to take that step, to make that choice?
Yes, if it's medically warranted, of course. We wouldn't just do a CAT scan for fun, obviously, but if it is something, the provider would do an assessment and determine whether or not that was necessary, and they would make the referral. And again, if you wanted that information shared with your primary care physician, we could send that over, but the results would come to us, and then you would have a follow-up appointment, and we'd go over those.
Okay, great. And the copay would still be the same what it is through our Kaiser premiums?
Exactly, exactly. Anybody else? Oh, yes. Mhm. Oh, hang on just a second.
We're recording, so we want to hear everybody.
If I choose to stay with my Kaiser doctor and get my tests and everything done there, and you have the medications here, could I go ahead and talk to my doctor here and say, okay, I want this, this, and this medications if you carry it with no charge versus going to my Kaiser doctor and say, okay, well, Dora, you need this, 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 and this.
Yes.
So I
Yes.
can't- Okay.
That way we do work with your primary care physician. We have a lot of people that will do that too. They don't necessarily, they love their primary care and they want to stick with that provider, and so they just use our dispensary. But it wouldn't be, you would still have to come in and make an appointment. And again, that's back to the patient safety issue. The providers would work with your primary care physician to say, hey, I'm noticing that this might need to be, modified a little bit, this dosage. Are you okay with that? Yes, we are. And that's how it usually goes. Yeah.
Thank you.
Sure. Anybody else?
Here. After those hot dogs, this is good exercise.
Okay, my question is on the same line as Dora's. With routine blood work, would we have to see the doctor first and explain to him, or could the records come over from our medical provider and work with the system here to have that routine blood work done, such as people who have diabetes, arthritis, and those type of medical, even for people with heart conditions? Can
Yes.
that be
Absolutely.
Handled-
Go ahead. Was there an
handled
extra
here?
piece?
I mean, that's a question.
It can, it can. We have people that are on, for example, if you're on a medication that's for blood clotting or a blood thinner, there are people that have to have routine labs drawn. They still go see their endocrinologist or their primary care physician because that's the person that's making the order for the labs. You can bring in your labs and we'll draw them if it's we have kind of a preset labs, and we really do most of them. It's more of the really obscure, ones that are super specialty that we might not be able to do. But for the most part, we really run all labs, and we do that for other providers. And it's usually a lesser of a fee. You don't have to pay the copay for the labs there.
Thank you.
Will you guys have flu shots for our dependents and stuff?
We will be providing flu shots this year. It is for employees and, I believe, spouses, dependents. Charles, you might want to help me with that one. I've got lots of clinics in my brain, and I wasn't thinking flu shots. So do you remember off the top of your head? Is it just employees? Okay, so it's just employees that, with or without insurance.
Okay, thank you.
Thanks, Charles. Anybody else? Questions? And those flu shots, you'll be able to get either in the clinic by appointment, or you can do them at the health fair. We'll be doing them then too. So. Yeah, no, you're fine. I'm here all day.
If a dependent wants to come in, like your husband, for instance, wants to, does the employee have to be with them to come in, or can they just come in and say?
Oh, no, and just to reiterate, the question was, if you have a dependent that wants to come in, a spouse, do you have to be with them in order to come in? No, you don't. They can come in on their own without you even knowing it all, so their records are still maintained. And we don't share records with spouses unless we get approval and written consent. So, yes. Any other questions? Okay. Well, if you have any individual questions that you'd like to ask, medical questions specifically about the clinic or how we would do things pertaining to you, you can come up and ask either Jen or me. Like I said, we're both nurses, so we will be seeing you in the clinic. And we really appreciate you coming out and listening. Thank you. Yeah.
Thank you, ladies. Great job.
Yeah.
It's sad that I worked on the FAQs and I had a queue.
You know what?
But it happens.
Just needs your help.
Right. No, I just talked myself, my wife does, she has rheumatoid arthritis. And so she's on those medications for it. I thought to myself, well, if it's a 90-day supply, no big deal. Yeah, she can drive out here once every 90 days, but if it was a 30-day thing, she had to come out every month, it'd be a lot easier. The spouse could